Acute rhinosinusitis is among the most common reasons for patients to seek medical attention. In an effort to assist clinicians with the diagnosis and management of acute rhinosinusitis, the 2011 Canadian Sinusitis Guidelines emphasize the importance of the nasal examination in assessing this very common problem. In this short instructional video, we will illustrate and describe effective techniques to examine the nose that you as a medical practitioner can use easily in the office or clinic when seeing patients with sinonasal complaints. We will cover doctor and patient positioning, proper holding and placement of instruments, anatomical structures to examine, as well as common pathological findings to look out for. We will also illustrate and describe some procedures that the otolaryngologist might use if your patient is referred for assessment of their sinonasal complaints. When you refer your patient to an otolaryngologist for their persistent nasal or sinus complaint, they may be examined with either a rigid or a flexible endoscope. For the nasal examination, the patient should be seated in front of you in an upright position with their head roughly at the same level as yours. This avoids the need to unnecessarily bend down and potentially strain your back. Right-handed clinicians should be standing on the right side of the patient. The nasal examination is usually performed with a headlight and nasal speculum. However, this equipment is not always available, and we will also describe a technique using an otoscope to examine the nose. If the headlight and nasal speculum are available, these should be used to examine the patient. If you are right-handed, you should hold the nasal speculum in your left hand and place your index finger on the tip of the patient's nose. The speculum is then passed in the nasal vestibule and opened to gently retract the alar margin. The light of the headlight may then be placed into the nose to examine the nasal cavity. Alternatively, the illumination and magnification provided by the current generation of otoscopes allow good visualization of the internal nasal structures, and thus the otoscope can also be used to examine the nasal cavity quite effectively. In this instant, the otoscope is held in the right hand for a right-handed clinician, and the tip of the otoscope can be passed through the nostril in order to examine the internal nasal structures. Three important areas are examined, including the nasal septum, the inferior and middle turbinate, and the middle meatus. Now let's look at a few anatomical and pathological entities that you may encounter during your examination.